You're listening to The Social Workers on WCDB Albany.
And welcome back. You're listening to the Social Workers live radio talk show here on WCDB Albany. My name is Eric Hardiman, and I'm here with Alyssa Lotmore, my co-host. Welcome back, Alyssa.
Hi, Eric. It's good to be back live in studio.
It's good to be back. It's been a while since we've done a live radio social workers talk show, and we're excited to be here. We've got two live guests in the studio with us. Alyssa, would you like to introduce?
We have Claudia Vega, the Director of Community and Prevention Services at Whitney Young, and we also have a BSW student who is interning there, Brian Zimmerman. So welcome to the studio, and we're really excited to hear about Whitney Young and all that you offer there.
Welcome.
Great, thanks. Happy to be here.
So, Claudia, as Alyssa said, you're an alum of the School of Social Welfare, and I wonder if you could, as we get started, just tell us a little bit about how you found social work and what your, your introduction to what's your drive to be a social worker?
Sure. I got my undergrad here at SUNY for urban planning and geography. And one of the aspects that I really loved about urban planning was that social piece, that idea that the urban structure affects how people behave. Or how they live, right? So I kind of zoned into that, and I started thinking about community organizations and other services that are provided to these folks that are walking on the streets, right? And obviously I always wanted to help people. So those two combinations really took me to pursue my master's. And I live in Albany, and I've heard that the school was the best, so I applied, and it was great.
Great. Well, we're glad to have you here as an alum, but also in your current role working for Whitney Young.
And I think, Brian, I just want to have a quick introduction with you, too, as a BSW student. Going into, BSW students, this is your time you have your first real internship into the field. And I know you come from a family of social workers, but what was it like going to Whitney Young? Because I believe you had the connection with school social work or familiarity with school social work, but what was it like to go into Whitney Young? Or tell us a little bit about Whitney Young and then how it was like to adjust to that in your first real internship.
It was definitely different. I mean, the idea of working in a real agency and getting that real professionalism sense was different for me. I'd never done it, and when I went to the interview for it, they were like, "Oh, would you be interested in working with substance abuse?" And I said, "Well, I've never done that before, so that would be something that would be interesting to me." And upon getting into the agency and starting, I've been given so many opportunities. Starting off with running our rehabilitation groups. And I do 4 groups a week, and it's a series of different topics where, we feel that we provide a support system for our clients where they get to voice their feelings about certain struggles they're going through and just certain issues that they want to talk about. But I've also been able to get involved in the intake process and reassessments where we are checking in on our clients and assessing their needs base and just checking in on how they're doing and also doing testing for HIV and Hep C, which has been something that had been scary for me at first, because the idea of saying, well, what if these results come back positive? How do I voice, in a calm manner, and tell someone that they are positive for Hep C or HIV? But I mean, it's been a great learning experience, and I've definitely loved my time there.
Great. So, Claudia, maybe you could tell us a little bit about Whitney Young. For those listeners that aren't familiar with Whitney Young Health Services, could you tell us a little bit about the organization and sort of where you fit in?
Yeah, Whitney Young is a nonprofit organization, is a federally qualified health center, accredited by the Joint Commission. We have around 150 employees. We provide services without regard to income. Services such as WIC, so women and children. We have a dental department. We have a big mental health department, a behavioral health department, which is actually expanding. So it's going to be even bigger. Currently, we have maybe 6 social workers or behavioral health practitioners under that department. We have pediatricians, we have women's health, primary care in general, and then we have us, the Community Prevention and Treatment Department, where we serve the folks that are HIV or hepatitis C infected. We provide walk-in HIV and hepatitis C testing, so at no cost. You can come in and get tested whenever you need to. We provide those linkages to that very important care for HIV, and we support them throughout the whole process. We have care coordinators that hold their hands. We have a licensed behavioral health practitioner who does clinical work with them on a regular basis, run groups, and we have currently maybe 180 HIV folks that we serve, and maybe 160 hepatitis C folks. So, there's 17 people in our department. We've really worked with integrating Whitney Young with the several buildings that we have. We have one in Waterville. We have a health center in Troy. And we have the place where Brian works, which is the Methadone Maintenance Clinic. And we run from that building, we run a primary care, the methadone maintenance, and another outpatient substance abuse group.
Okay.
Yeah.
And are your services geographically restricted to Albany County residents, or do they? Nope. Is anyone?
Anyone is welcome to come.
Great.
In the capital region. So.
Great.
And we have like bus passes for patients. We really help them to monitor the care, especially with HIV. It's so important that they continue to take their medication on a regular basis, and keeping track of that it's really important that patients come in and we can monitor their medication adherence.
Yeah. And have you seen the services change over time? I know you've just been there a couple years, but do you see some sort of shifting trends in the HIV, Hep C sort of world?
I think there's a big push for that integration of behavioral health and primary care. So how we fit in is the HIV and hepatitis C is that the primary care is right there, so we just need to incorporate the behavioral health piece and really make it part of everything that Whitney Young does.
And for listeners who may not know what you mean by behavioral health, can you sort of define the parameters? What is that sort of code for behavioral health?
I guess it's provided by licensed clinical social workers or licensed mental health counselors. It's clinical work. I guess But I guess what I'm getting at, does it include substance abuse treatment? So I typically think of behavioral health as being sort of mental health plus substance abuse. It does include, yes.
Okay.
So the organizationally, the chief of behavioral health, Janice Pritchett, she's the one who's overseeing both the behavioral health department and my department, which is the Community Prevention and Treatment Services.
Okay.
So there is definitely that substance abuse piece, especially with hepatitis C, and that clinical work.
So if someone comes in and they've got, sort of an array of challenges facing them that might include addictions, but also include some health challenges and problems, but also might include some mental health issues as well, all of those needs can get met.
Yes, absolutely. And hopefully in one building.
Right.
That's the idea. The person gets in and they can just go around the building and get everything that they need.
Yeah.
And very open communication between the departments and really utilizing those communication skills to be able to get the best outcomes for the patients.
Great.
Now, there seems to be a lot of services offers, which is great, but a lot of free services, because you said regardless of income. How is the program or the agency funded? Is it through a lot of grants or? So
the Whitney Young as a whole is a nonprofit, so lots of fundraisers. We do get. People come that have Medicaid or Medicare, so we get the finances come back in.
Yeah.
For my department, it's a little bit different because we're completely grant-based. I oversee 4 different grants, 2 federal, 1 provided by SAMHSA, which is the Substance Abuse Administration, and 1 from Ryan White, which is from the Health Human Services Department. And then the 2 state ones are provided by the AIDS Institute, and all of these are all HIV or hepatitis C. So we're really grant-based. We get paid to do the work we do, and we just do it.
Yeah.
Well, it's needed work.
Oh, yeah, absolutely.
And without having a crystal ball and or wanting to get too political, I would imagine that there might be some changing, the future is maybe a little uncertain when it comes to grant funding for this type of work. And I wonder if folks in your department or in your organization have thought about that much, about sort of what the immediate future looks like for grant funding in health services and behavioral health.
Yes, I think there's been several conversations and how, really not knowing. We're a little bit in the dark. I'm just hoping that as a chronic disease, HIV and hepatitis C will not be touched as is. We have a lot of support from the state, which I really think that is not going to change. So with Governor Cuomo's plan to end HIV by 2020, or the spread of HIV by 2020, by having like 750 folks out there with HIV. With uncontrolled HIV, I guess. So I think that we'll be okay.
Okay. Knock on wood. Yeah.
Yes.
Yeah.
I'd like to know a little bit about how you do outreach. How do you get the people to know about your agency and people to come to your agency? I mean, you offer a lot of services, but getting people who might be hesitant to go to agencies, or if they feel vulnerable, or they have a diagnosis and they're not sure how to handle it, because it's very, I'm sure, emotional for anyone to go through that. What kind of outreach do you do to get people to know that you're available and that you're a resource for them?
Yeah, there's Whitney Young as a whole. We have a development department who's great, and they use Facebook, and they have several blogs. So they promote the health center as a whole as a place where you can come. Then we will serve you without regards to income. But for us in the community prevention and treatment department, as you said, it's a little bit a little bit harder. One of the things that I do have to say is that the folks that are receiving services now have been receiving services there for a very long time. It's a very tight-knit community. Maybe 10 years ago, when they were getting services with us, we would provide, now we no longer do it, but we would provide lunches and dinners, and everybody would be in the basement of Whitney Young hanging out and being able to have this community sense, which is so important. It's less now because it's a health center, so we can't have parties in the basement. But I think word of mouth amongst the community that we serve, that's a big part. We have several MOUs, so memorandums of understandings with community-based organizations where we go and test at their places at no cost. So we write a memorandum that is very specific into confidentiality and how we're going to need a private room to do pre and post counseling to the patient. All of our staff have been trained in really having those very, very tender discussions after, if your test does come reactive. So we have maybe 7 or 8 agencies that we visit on a regular basis. Right now we have 2 staff members that are going there maybe twice a week to different places, and we provide testing. And the thing with the testing that we do, which is an OraQuick swab, is that you may get a reactive result, and we call it reactive because it's not 100% proof. So if you do get tested in the community and you happen to be reactive, we would make sure to say, this is not for certain. We just need you to get in, come to Whitney Young. We're going to do a confirmatory test, and we're going to help you through this process. I might even put him in a cab and send him to Whitney Young, so I'm sure that he doesn't go and freak out alone somewhere. So we have all those protocols in place to really, keep in mind the safety of the patient, and that we're going to really provide the care that they need.
Yeah.
So, like, for example, we're going to Pride in June, and the Black and Latino Parade as well.
Great.
We'll be there with a little table promoting our services. AIDS Day that happened in the Egg, we were there with a table with all sorts of information. We're now, one thing I forgot, we're now promoting in the Community Prevention and Treatment Department PrEP, which is pre-exposure prophylaxis, which is a one-day pill that prevents you from getting HIV. So, I mean, lots of different initiatives out there to prevent HIV, and then to actually serve those folks if they need the treatment.
I mean, it seems like you're doing so much. What are some, like, if you could summarize, this past year, what is a big accomplishment, or what are some of the things that you're most proud of for the agency and all the work that you and your team are doing?
Well, I had a baby.
Congratulations.
Baby. That's a really big accomplishment.
Yes, it is.
Yes. I think implementing PrEP, which is, it's been huge because we didn't apply for a grant for PrEP, so we had to utilize our existing resources and really kind of move staff around and have everybody on board to really be able to implement this program. Getting the physicians on board, being able to create those workflows and those protocols to really, get them to get the treatment that they want, and promote it out there too, because a lot of people don't know what PrEP is and don't understand it. Okay, so does that mean that I don't have to use a condom?
Right.
No, it doesn't. I mean, it prevents you against HIV, but nothing else. And so really trying to team up with other folks to provide education and go out there and have presentations about PrEP, or for example, there might be some providers that would say, no, that's kind of against my beliefs.
Right.
I don't want to promote behavior that might lead to something, so I will just tell them to use a condom. I'm not going to give them a pill. So that might be fine, but if you do get the education that you need, eventually you're going to say, like, oh, okay, well, you're right, they're going to be doing it anyway, so So I think that was a good accomplishment.
Any goals for this upcoming year? What you sort of are looking to accomplish, or something that you've been working on that you're really hoping sort of takes off?
Yeah. Well, we might be applying for another little grant that is going to be about prevention and STD and hepatitis C testing, and it's going to be targeted to women of color. So I think it's going to be really good for the team, just to really find those folks that we really need to help, and even though it's a little bit specific, I think we're already serving so many people that I think it's going to be good, and it's going to bring us out from the HIV and hepatitis C, but also take us to like STDs. So, which I think is something that it's out there for sure.
So, if you've just tuned in, you're listening to the Social Workers Live Radio Talk Show, and we are interviewing Claudia Vega from the Whitney Young Health Center here in Albany, and we're talking about HIV, hepatitis C, and all of the various behavioral health services that are offered at Whitney Young. So, I guess could you tell us a little bit about maybe the staffing at Whitney Young? I mean, I would assume you have medical professionals, but you also have social workers like yourself and Brian in training. But tell us a little bit about sort of, who staffs the health center and how the different disciplines maybe work together.
Sure. Well, as I said, there's 150 employees. There's the behavioral health department has maybe 5 licensed clinical social workers or licensed mental health clinicians. We have, I think, between 5 and 10 dentists. We have maybe 15 different providers. Some of them work part-time. Some of them are there full-time. The CMO, the chief medical officer, chief of operations, all the chiefs, and I guess we have the women's health department. There's 2, I believe, ladies that provide women's care, maybe 5 pediatricians. So really a combination of administration, primary care, and behavioral health. In the MMTP clinic, we have maybe 7 counselors with CASACs, right now a lot of care coordinators. There's some new grants that are happening in the area of substance abuse, and so there's always an opportunity to work at Whitney Young. I can say that we're always growing, moving, and moving forward toward our goal, which is our mission.
So I'd like to swing it over to Brian now and ask sort of about your internship and what sort of the opportunities were you exposed to already these past few months, and what are you hoping to be exposed to or get some familiarity with in the final 2 to 3 months of your internship?
I touched upon it in the past. I've been working with the substance abuse rehab groups, and that's been such a great experience for me in general, because a lot of times when students get they receive an internship, they're wondering, okay, well, what will I be doing? How much client contact will I have? And I think, that alone has given me so much client contact, being able to run groups of 8 to 15 people and have to control a certain topic and keep people on task has been definitely a great learning experience that I've come to enjoy. And you really get this sense that you get to know the clients, get to know their struggles, and possibly even help them seek some solutions for these struggles. And I've been really enjoying that. The intakes and the reassessments has been really educational and informative to me. Being one-on-one with a client, I feel like, is a lot harder because it's just you and them. When you're in a group, you can kind of bounce ideas off of different people, but when you're one-on-one, the stresses kind of kick up a little bit. So being able to offer services and have that information that the client needs, and being able to tell them exactly what our program does and who's involved has been definitely a test for me. It's a sense of professionalism to be able to accomplish these things and feel that I've informed the client with all the questions that they've had, with all the answers that they needed. So that's been great. And the outreach side of it, every week I go out with our linkage specialists, and I get to see, different aspects of the community. We've, been to different locations. I've done testing. We've, increased, information, about our program and given people, the answers that they're looking for. If they're like, oh, well, what is Upbeat? What is Facts? What is, how do your programs work? We have multiple sources of information that tell them exactly, what we are and what we do. So it's been, such a great experience.
Great. And how does that fit in with your classes? I mean, for those listeners that we have that are listening and thinking about what it must be like to be a social work intern, you're taking classes a few days a week and then at Whitney Young a few days a week too. So, maybe talk about the interplay between what you're learning in the classroom and what you're doing at Whitney Young.
Yeah, one of the main things that I think crosses over is every, for my social work practice 4 class, we have to write a blog every week. And a lot of the things, touch upon your experience with internship. And I feel that my experience has been so rich and fulfilling that there's no topic I have not been able to touch upon with great detail and, talk about what a great experience I've had. We've talked about different aspects of social work where it comes to, the one-on-one, coalition building, and being able to build a good rapport with clients. And I feel like those skills have, definitely been shown within my experience at Whitney Young. And, balancing class and internship is, it isn't a hard thing. You go to internship 2 days a week, you have class, the other 2 days. And I think it creates a good schedule for students so they can balance these things out and have a good experience no matter what agency they're at, what population they work with.
Great. Great.
Yeah. I mean, as we're winding down, we've learned so much about Whitney Young and the experience for you as staff and interns, but also all the services that are offered for individuals and how this is sort of like a community-type feel, a family-based feel in the sense of everyone coming together and offering services in one location. But I just want, for those who are listening who might be interested, where's the location? How do they contact you? What's the best way for people to reach out if they want services or want more information or education?
The address is 920 Lark Drive, Albany, New York, 12207, and we have a Facebook page, Whitney Young, Whitney Young Junior Health Center. Whitney Young. Yes. And the phone number that I don't know by heart, that I can get back to you
That's
on that.
okay, yeah.
But the Facebook page is, there's, and we have our own website as well. So if you go to whitneyyounghealth.org, everything is delineated there. You can find every single service and every single phone number to get in touch with us. I wanted to add one of the things that Brian participated in, that was, it would be more for macro students. He participated in our quality improvement committee, which meets quarterly. This committee, we really look at those deliverables where we really need to improve how they've been created, or like the systems that we've put into place, and learning about doing small changes throughout time to be able to really create a major change and improve something. I think it's something that any student it's great to be involved. So, and he's been great.
Yeah, so it sounds also like having students at Whitney Young has been something that's important to the organization.
Oh, absolutely. We have a relationship with SUNY, which has really grown in the past few months, and I think that coming into the next semester, we're going to have maybe 5 or 7 students.
Great.
So we're really looking to educate and have folks really learn about what we provide.
Yeah, and those opportunities, from my perspective, being at the School of Social Welfare, are exactly what we're looking for students, that we really want to be able to provide that integration of classroom and field, and to show, the larger community, too, that the University at Albany is not just about being on campus and learning in the classroom, but it's also extending that learning into the community, making a difference in the community, and being, really meaningfully engaged with the community and with populations that need assistance.
Exactly, absolutely, and learning from a lot of different multidisciplinary. Yeah, it's a really good experience. So
what's down the road for you? What's 5 years from now? Where do you see yourself headed with all this, Claudia? It's a tough question.
Yes, a tough question. Well, I'm going to be staying with Whitney Young for a long time, hopefully. I really enjoy my work there. I'm not sure. I think I actually enjoy change, which is weird because nobody really likes change, but I love the challenge. So I don't know, in a few years down the road, I'm not sure.
Well, we'll need to get you back to the School of Social Welfare and get you talking to some of our current students. Maybe do some guest lectures for us. And
especially as an alum, I'm the alumni coordinator for the School of Social Welfare, so we're always looking for alumni to come back in the classroom, talk to students, do continuing education presentations on important topics for other alums and students.
Absolutely.
So I'm really, any other alum who are listening, that's definitely, I'm the contact for that. But we really, really love to share this information with a lot of our students. It's so valuable.
I remember when I was in school and we had panels of people that had been in the workforce for a while, how important that was. Right. I looked at them and I was like, I want to be her. How do I get to be her? So I think it's great.
Yeah, and it's an exciting profession. I mean, it's a profession, we were talking about it out in the lobby before the show, where you can go lots of different directions, and you can be a therapist, you can be a one-on-one helper, you can run groups, you can do community projects, you can
write grants,
you can do policy work, you can do all of these things at the same time in some cases, but it also can be overwhelming for social workers to know, where do I fit into this large profession. Yes. But it seems like you've made a niche for yourself, and you're being successful with it. It's great.
But thank you so much for you both coming in the studio. Thank you, Brian, for having this be part of your final project for your senior year placement. So I just want to say thank you for sharing this information. I mean, I'm not even familiar with all the stuff that you've mentioned today, so I was informed, and hopefully a lot of our listeners were too, and you'll get some more. It's another way of outreach.
Absolutely.
So make sure to check out, if you're listening and you want to find out more about Whitney Young, the Whitney Young Health Center.org, is that right?
Whitney Young whitneyyounghealthcenter.org. Yes.
Okay. Or maybe
It'll
just
take you there.
Yeah, if you Google
Google it.
Whitney Young Health Center
It'll take you to the
Albany,
website.
you will
Yeah.
find information about Whitney Young's programs and the various aspects of what they do. So you've been listening to the Social Workers Live Radio Talk Show. We've been interviewing Claudia Young and Brian, and I'll forget your last name here.
Claudia Vega, too.
Yeah.
Claudia Vega, sorry, and Brian Zimmerman. Great, thank you so much. I apologize for the lapse there. Maybe, Alyssa, if you'd like to tell listeners where they can check this show out again, if you tuned in late, or if you'd like to let friends and family and relatives and other folks listen to this exact interview, it will be archived, and Alyssa will give you some information on where to find that.
We have the Social Workers Radio Talk Show YouTube channel, which you can subscribe to. This video should be up by the end of the day or tomorrow. It'll also be on the Social Workers Radio Talk Show website. A link to it will be on the School of Social Welfare's web page, too, for the University at Albany. We have a Facebook page, a Twitter page, so either through the SUNY Albany School of Social Welfare or the Social Workers, you'll be able to find it.
So we are connected. We're very connected on social media, and all of the previous shows for the past several years are also logged on, are available, archived on the YouTube page, and can be linked through the Facebook and the Twitter pages as well. So there's lots of topics you can listen to and check out the Social Workers, other interviews, other topics, other realms.
And we're always looking for new guests, especially
Yes.
from our alumni, and see what they're doing. As you were saying, Eric, there's so many things that you can do with the social work degree. So our contact information is on our website, so feel free to reach out to us if you have an important, interesting topic at your agency that you're interested to sharing the information about.
Yeah. So thanks again for being here, Claudia and Brian. And
Thank you for having us.
You've been listening to the Social Workers, WCDB Albany.